I'm Dr. Padma Kumar, DNB FRCS, lead consultant, laparoscopic surgeon at Renai Medicity, Kochi. Today we will be discussing about endoscopic thyroidectomy, that is scarless thyroid surgery without any cut in the neck. All of you are familiar with thyroid problems. There can be two types of problems. One is functional. Functional means you have less function, that is hypothyroidism. If the thyroid is working more, then it is called hyperthyroidism. Hypofunction, only treatment available is you have to take thyroxine. That is a very safe medicine. It has to be taken in the morning and that should be okay. Almost like 20% of people are affected with hypothyroidism and they have to take medicines, keep the thyroid levels normal limit by checking it every maybe 3 months or 6 months. So when the thyroid function is more, it is called thyroid toxicosis. That means thyroid is secreting normal thyroid hormone. It is in larger quantity. That is harmful to the body because the pulse rate, our metabolic rate, everything changes when the thyroid hormone levels are on the higher side. So what has to be done is thyroid function test has to be done. We need to see whether the thyroid gland is also becoming bigger, whether it is because of thyroid infection or inflammation we call. If it is thyroiditis, that also to be assessed. Once you see thyroid is not much bigger, you can try medicines. It is called anti-thyroid drugs. That means medicines working against thyroid, by which you can reduce the thyroid hormone production, and the pulse rate will be on the higher side for patients, so we give medicines which will reduce the pulse rate also. But thyroid function, if it is more and there are gland enlargement, that means goiter also, then what we should consider is, it is called as secondary thyrotoxicosis, or when there is a nodule with thyroid, you may not be controlling the thyroid problem with medicine alone. Still, you have to try and control temporarily by thyroid medicines, anti-thyroid medicines. Anti-thyroid medicines are not really safe. You cannot continue for longer period of time because it can reduce blood cell count or other problems. So what we do is give it for some time. If thyroid hormone levels are getting into normal, fine. Then the gland has to be removed. If it is not really controlled, the gland has to be removed. Other problems for the thyroid is tumor problems. That is called goiter. Everybody knows thyroid can enlarge, increase in size and make like nodules, we call it medically, and that is a thyroid goiter problems. For goiter problem, we definitely need surgical treatment because once swelling comes, it may not go itself and you may require surgery. If surgery is required for either it is goiter, whether it is cancerous or non-cancerous, you may need surgical treatment. Operation is required means you had option of only open surgery, big cut in the neck, and that was the only option available. So how you decide whether I need surgery even if you are seeing a swelling in the neck? You have to go to a surgeon, get the checkups done. One is physical examination. Doctor will see the person and decide how much is the thyroid enlargement, whether it is on one side or both sides. Then ultrasound examination will be done to see what is the size, whether it is there on one side or both sides. Multiple nodules we call as multinodular goiter and all. That means it is there in different parts of the thyroid gland. Then needle test is there, FNAC, fine needle aspiration cytology. Once we do all these tests, we know, okay, this thyroid is problem 1, we need to remove it. Even if there is no problem, but still the size is more than 4 centimeter, you have to remove the thyroid. Otherwise, what will happen? The thyroid is enlarging in size, it can press onto the respiratory passage, you can have breathing difficulty, swallowing difficulty, then voice change, all those things are possible. So, you cannot keep larger thyroids in the body even if it is non-cancerous. Once decided, okay, this thyroid is something which has to be removed from the body because of its size, because of its problems, nature, because we are suspecting cancer. Anyway, we have decided, or it is not, it is functioning extra, like as I told, thyroid toxicosis. We have to decide, okay, thyroid surgery has to be done. Then what are the options available? As I said, only option available was open surgery. then patients will not come for surgery because they are afraid of operation scar, operation induced pain and all the problems. So they will think we will postpone it like. But now a blessing, thyroid operation can be done without cutting the neck. It is called endoscopic thyroidectomy. It is a keyhole operation. You make small incisions in the axilla ambit area, under the skin and the fat. Maybe if it is required to do the both sides, maybe you will make 5 millimeter of cuts on the opposites also. Then you can introduce small tubular instruments which we otherwise use it for keyhole surgery of the abdomen and stomach, all those. Same instruments you put it, so you don't have a cut in the neck across large cut, no need. You can put those instruments and very safely you can do the endoscopic surgeries. If it is on one side, you can just do from that side and remove that gland on one side. It is called hemithyroidectomy. That means one side of the thyroid alone is removed. If it is problem on both sides, or if you have a cancer suspicion, then you go and do it on the opposite side also. So you can see, because you are using keyhole system, means you can see it bigger on a screen. Surgeon will be very widely seeing that area. Then he can see even small blood vessels big, so that safely operation can be done. The fear otherwise for patient when our thyroid operation is done is whether voice will go, whether calcium tablet to be taken. Surgeon, when they are doing with endoscopy, because of the high definition camera, they can see it very nicely, so that the nerve will be safe. The calcium metabolism is done by the parathyroid. So calcium controlling gland, the parathyroid also will be safe and kept. So complete nice removal of thyroid tissue which is bad can be performed by endoscopic method very safely and nicely if the surgeon is familiar with it. That is a prerequisite. The surgeon has to know both endoscopy procedure as well as thyroid surgery. So if you are having a thyroid surgeon who can do, who has skill in both, then you can have an endoscopic thyroidectomy in the best way possible. If it is on the opposite side also, we put additional 1 or 2 5 millimeter very small instruments into the neck and you can do the procedure. Then the thyroid will be placed inside a bag and removed it. Even 1 centimeter cut is sufficient for removing something 5 centimeter, because this area skin is soft, very movable, and it comes off in the plastic or without any problem in that area. So patients will be very comfortable. No cut and there is no scar. Scar is also very minimal and it is in the area where it will be covered by the dress, minimal dress itself, innerwear itself it will be covered. So that is sufficient. You need to be in hospital for 2 days. Usually these operations take around 2 hours, and afterwards there is no much of rest or anything required. Little discomfort will be there for maybe for a few days. That is the usual show with endoscopic thyroidectomy. Even if it is cancer, you can do a good job with endoscopic thyroidectomy. If there are additional problems like lymph nodes, sometimes these lymph nodes will be bigger, and that is the second station where the tumor gets arrested. So that also can be safely removed by this method. When even with parathyroid tumors, we do endoscopic parathyroid surgeries. It is very comfortable, very small cutting, because the parathyroid tumor itself is like 1 or 2 centimeters. Just to take that, somebody is making a 10 centimeter cut. That is not required. So you don't have to have the fear of operation, fear of pain, or fear of having a large ugly scar in the neck. Especially for women, they don't like to have a scar at all in the neck, because usually the dress pattern is such that that area is entirely exposed. So you will not see anything in this area because it's only a very small cut. So that is a very good operation. Cost wise, if you ask, majority of them, if you have an insurance, usually insurance companies support. So if somebody has an insurance, they don't have to worry. Otherwise the cost will be all together, the hospitalization, medicines, everything together, maybe from 75,000 to 1.5 lakhs, depends whether it is both sides, whether you are taking a room or ward or thing. But altogether you can think of getting it done even at 75,000 rupees. Maybe it can go up to 1.5 lakhs if it is both sides and you are taking a higher category of accommodation and package. So it is a very comfortable thing. What you should do after operation, the specimen is sent for biopsy. Biopsy report when comes, if it is telling like goiter, no cancer, you need to just continue the thyroxine only. If it is telling cancer is there, then you need to do iodine scan and testing whether any medication is required. But still, don't have to worry about cancer of thyroid because you don't require any radiation, you don't require any chemotherapy. All these things are a little uncomfortable for patients. Maximum what is required is radioactive iodine. It's only just one day you can swallow those radioactive medicine, and even if it's cancer, it will get corrected. But thyroxine, if it is totally removed, thyroxine has to be taken. Maybe temporarily calcium is required. So it is a very comfortable operation. Whenever you need a thyroid operation, think of endoscopic thyroid surgery so that you don't have to worry about neck scar. Thank you.
Let it go, make my body go. Make our bodies high.
11 minutes சார். இதில் நம்ம கொஞ்சம் அந்த முன்னாடி அட்ஜஸ்ட் பண்ணல. அதில் மேக்ஸிமம் இது ஒரு 9 minutes வரும்.
ദയവന്ന് മലയാളം തേവ